If you're brushing your teeth like this, we need to talk. I'm Dentist Tikka, and I've spent years helping people achieve brighter and healthier smiles. And hey, I get it. You think you know how to brush your teeth because you've been doing it your whole life. But what if I told you that most people are making some crucial mistakes every single day that can damage their teeth? Not only are you risking damage, but you're also missing out on the full benefits of brushing, like cleaner teeth, fresher breath, and better overall health. Stick around, because in this video I'm going to reveal the 5 biggest brushing mistakes and how to fix them. And trust me, by the end you'll be brushing like a pro and protecting your smile for life. We'll dive deep into why brushing harder is actually worse, the perfect time you need to brush, how to clean those tricky spots you're probably missing, and why the tool you're using might actually be part of the problem. Let's go! Okay, first up, the most common mistake I see: brushing too hard. Brushing too hard is like using sandpaper on your teeth. You're not only scraping away plaque, but you're also wearing down your enamel and irritating your gums. Instead of scrubbing, you want to think about brushing like a massage on your teeth and gums. Many people believe that brushing harder means cleaner teeth, but that's actually a huge misconception. Your enamel, the outer layer of your teeth, is the hardest substance on human body, but it's not invincible. Aggressive brushing can wear it down over time, leading to sensitivity and even increased risk of cavities. Scrubbing can also irritate your gums, causing them to recede and expose the sensitive parts of your teeth, which can't be regenerated once lost. That's why you should think of brushing as a gentle massage on your teeth and your gums. Use soft circular motions instead of hard back and forth scrubbing. This allows you to effectively remove plaque without irritating your gums or wearing down your enamel. You want the bristles to glide along your gum line and your teeth, not dig into them. If your bristles are splayed out after just a couple of weeks, that's a sign you're brushing too hard. How many of you thought brushing harder meant cleaner teeth? Drop a comment below. I'm curious, how many of you were guilty on this one? Here's a surprising fact. Studies show that brushing gently removes just as much plaque as brushing hard. The difference is, gentle brushing protects your enamel and gums. Next up, time. How long do you think you're supposed to brush for? 30 seconds? 1 minute? 2 minutes? Most people brush only for 45 seconds to a minute. But you need to be brushing for a full 2 minutes, twice a day. Here's why. Each tooth has multiple surfaces that need cleaning. And if you're rushing, you're leaving a lot of plaque behind. That means cavities, gum issues, and eventually more trips to see people like me. Right. Here's an easy hack to make sure that you hit that 2-minute mark. Use a timer or get an electric toothbrush with a built-in timer. You'll know exactly when you hit 2 minutes. I challenge you. Next time you brush, set a timer on your phone. It will feel longer than you think, but it will be worth it. And hey, if you got your favorite 2-minute song, play it while you brush. What's your go-to song? Let me know in the comments. This next mistake is sneaky, because you might not even realize that you're making it. Ignoring the gum line. Most people focus on the surfaces of their teeth, thinking that's where all the plaque builds up. But the truth is, plaque loves to hide at the gum line, right where your teeth and gums meet. If you're skipping this area, you're missing out one of the most critical parts of the cleaning process. Plaque at the gum line is like a hidden enemy. It starts soft, but if you leave it there too long, it hardens up into tartar, which can't be removed by brushing alone. Over time, this leads to gum inflammation and even gum disease, which can cause your gums to pull away from your teeth. This creates pockets where even more bacteria can hide, leading to serious issues like infections and tooth loss. Gum disease isn't just about your mouth though. Studies have shown that it can increase your risk of other health problems like heart disease, diabetes, and stroke. So by not brushing your gum line properly, you're not only harming your oral health, but also your overall health. To avoid this, Angle your toothbrush 45 degrees toward your gum line when brushing. This allows the bristles to get under the gum line and remove any plaque that's hiding there. You want to be gentle, using small circular motions to ensure you're cleaning the gums without causing too much irritation. A lot of people ask me, what if my gums bleed when I brush my gum line? Well, bleeding gums are actually a sign of inflammation, often caused by not brushing the gum line enough. It might be uncomfortable at first, but with consistent care, your gums will get healthier and the bleeding should stop. This one's a biggie. You might be using a wrong toothbrush. If you're using a toothbrush with stiff bristles, or if your brush head is too big for your mouth, you're making it harder to reach all areas and could be causing unnecessary damage. Here's why this matters. Stiff bristles might be too abrasive on your teeth and your gums. Your teeth are covered in a protective layer called enamel. Once this enamel wears down, it doesn't grow back. Stiff bristles combined with aggressive brushing can erode this enamel over time, leading to tooth sensitivity, discoloration, and increased risk of cavities. It's irreversible damage, and that's why softer bristles are always a better option. And on top of that, stiff bristles can also irritate your gums, causing them to recede. When your gums recede, it exposes the sensitive part of your teeth called dentin. This leads to pain and increased sensitivity. So while it might feel like you're getting a deeper clean, you're actually harming your teeth and gums in ways that can't be reversed. To avoid this, always use soft bristles. They're just as effective at removing plaque without the risk of wearing down your enamel. And if you can, go for a smaller brush head. It helps you reach all those tricky areas without putting too much pressure on your teeth or gums. Here's one you probably didn't see coming. Rinsing right after brushing is actually a mistake. And here's why. When you rinse right after brushing, you're actually washing away all that valuable fluoride from your toothpaste. Fluoride is there to protect and strengthen your enamel, so if you rinse too soon, you're basically undoing some of that good work. So instead of rinsing, just spit out the toothpaste and let fluoride do its job. And if you feel like you need to rinse after brushing, wait around 30 minutes. This gives the fluoride enough time to protect your precious teeth. Now that you know what to avoid, you're already ahead of the game. Did any of these surprise you? Let me know in the comments which mistake you were making. And if you're ready to take your dental health to the next level, hit that subscribe button. And let's keep your smile healthy for life.